Officials so concerned now about the spread of the Zika virus that they have this new plan to prevent an outbreak here. The virus is spread by mosquitoes. It can cause serious birth defects. Randy Paige live in downtown LA with details on what officials plan to do right here. Randy?
That's right, Santa. We are live in front of county health headquarters where a news conference got underway, and we really learned a lot about where things stand right now with this virus. Let me begin with the headline. And the headline is that according to all of the evidence gathered so far, there's not a single person, as far as they know, who's been infected in California as a result of mosquitoes. Only one case, in fact, has surfaced, one documented case. That was a woman who was in El Salvador and contracted the disease there, they believe. That was back in November. She hasn't come in contact with any mosquitoes, so they're not worried about her transmitting the disease to anyone else. But we also learned that there are between 10 and 20 possible cases. Blood samples have been sent to the Centers for Disease Control. And of these 10 to 20 people, half of those people are pregnant women who have the symptoms and who've recently been to parts of the world with the virus. So that's a very big concern. It is worth noting most people who have this virus don't even know they have it. They know there are no symptoms. Those who do feel symptoms, usually they're mild. The real concern is birth defects when pregnant women contract this virus. And then the question of sexual transmission of this disease. Is it only mosquitoes or can it be sexually transmitted? Well, Dr. Jeffrey Gunzenhauser, the interim health officer here, says that is extremely rare. Listen to what he had to say about that.
Likely this is to be rare. While people are concerned about it, I think it's important for them to be informed, because if they have a partner, they may want to minimize any risk of transmission. But overall, from a community perspective, I don't think that's going to contribute substantially at all to any potential problem we might have here in the county.
So what should you do? Here are the recommendations, and the number one recommendation, the one that they were emphasizing the most, is quite simple. If you're pregnant or you think you might be pregnant, don't go to parts of the world where this Zika virus is present, because you could seriously risk your unborn baby. Secondly, if you do need to go to that part of the world, anyone who does, wear clothing that covers most of your body to avoid mosquito bites. Apply repellent. Stay indoors where there's air conditioning or screens. Try to avoid contact with mosquitoes altogether. Now, obviously, this is a time of year when there are very few mosquitoes out. There are greater concerns later this summer when the Olympics are going to be happening in South America, when there's a lot going on and people are moving to those parts of the world. So these recommendations could change, but as it stands right now, the belief is the risk is extremely low for contracting this virus here. One more important thing, they're asking everyone to get rid of any standing water in their homes. That's where these mosquitoes live. They're aggressive mosquitoes. They'll follow you inside. They will bite you. And we are live downtown. Let's take it back to you.
All right.